Joining us in the studio this half hour, health and medical experts from UPMC Hammett and the Erie County Department of Health.
From left to right, as you're looking, we'd like to introduce Dr. Greg Beard, a surgeon and UPMC's Vice President for Medical Affairs. Next to Dr. Beard, epidemiologist Emily Shears from UPMC Hammett. She is the Director of Infection Prevention. And on the far right is Charlotte Beringer, the Director of Community Health for Erie County. We want to thank everyone, first of all, for joining us because the topic is so important right now.
And let's just start off. Obviously, we've heard a lot about this, but what should we look for in terms of the signs and symptoms of the coronavirus? Because right now, everyone's just wondering, what do we look for?
Sure, I can handle that.
Great.
Reported illnesses have ranged from mild symptoms to severe illness and death for confirmed coronavirus 2019, what is known as COVID-19 cases. Following symptoms are typical from 2 to 4 days after exposure, and they include fever, cough, and shortness of breath.
What should someone do if they present with any of those? I guess it's better to be safe than sorry at this case.
Well, at this time, we are doing a lot of testing still for influenza and other respiratory illnesses. So we discern between coronavirus and influenza or the common cold really through epidemiological factors. So that would be our travel screening. We have 8 different countries now on that list. What symptoms are the patient having? And really, have they had any known exposure to any current ill cases?
Now, according to the CDC, as of late last night, there have been about 14,000 deaths, 250,000 hospitalizations in the U.S. alone from this year's influenza strains. The same numbers for coronavirus, much lower, 26 and 624. I guess my question is, why are we freaking out, or why are we freaking out? And shouldn't the average person be more worried about influenza right now?
Sure. As a community, we should have the right level of concern for both the influenza and the COVID-19 virus. They're both very important, and both have the potential for concern for vulnerable populations. We do have a vaccine, however, and known treatment to help mitigate the risk of influenza, and we don't have that yet for the coronavirus. We have an opportunity with COVID-19 to help prevent transmission and therefore to help prevent disease. So we want the public to stay informed about both influenza and COVID-19 prevention.
Well, I know there are numbers out there that you track. How bad is coronavirus compared to the flu? What is the mortality rate? Is it more deadly?
Well, there are different vulnerable populations. So with influenza, we know the very young and the very old are really the vulnerable populations. And we're getting preliminary data out of China that are suggesting over the age of 65 and really over 70, the death rate or mortality rate could be up to 10 to 15%. And that is why precautions are being directed at that population. And conversely, we're also seeing that the very young seem to have some mild illness. So that's a difference from influenza.
Well, how is it transmitted? I think that too is one of those things where you're hearing all these stories about, well, if you do this or do this, but how is it actually transmitted? Do we know that?
They don't know for sure, but they are positive it is a respiratory-like illness, so that would be what we consider large droplet through coughing or sneezing. So any of those droplets that would touch the environment, or if someone would come into close contact with secretions of someone that's been ill, that is how the virus can spread, by touching our faces or being exposed.
Let's talk about testing, because I think a lot of people, there have been a lot of questions out there, a lot of unanswered questions when it comes to testing. If I do have symptoms, can my doctor test me right now for it? Will my doctor test me for it?
Okay. Shar, do you want to address that?
Sure, I will certainly address that one. Testing, when someone is ill, they generally see their primary care provider first. If in that provider's assessment they need further evaluation for COVID-19, then they really need to be seen by an emergency room that is equipped to do the appropriate testing. Testing is still being coordinated with the Pennsylvania Department of Health, and all testing at this point is still occurring at the Pennsylvania Department of Health.
Are we equipped in our local hospitals?
Yeah, we are equipped to do the collection. So right now we know what specimens. They're recommending 2 upper respiratory and 1 lower respiratory specimen, and particular packaging to keep the laboratory workers and the healthcare workers safe. So all the healthcare facilities in terms of hospitals and emergency departments are equipped with that testing collection of ability.
Do we think at this point, now that Erie hasn't had any positive testing, but now it seems like we're all more aware, is that a good thing, that we're more aware now of what's going on and what to look for, rather than some of those places where it first happened?
I think it's very important to be aware, certainly of your environment, and not only for COVID-19, but even for the common cold and flu. As Emily stated, transmission is by droplet nuclei, and you can transmit the virus by coughing and sneezing. And there are at-risk populations who might have a higher risk for complications, and so keeping in mind the community and our necessity to prevent the community from getting ill. Very important to know the symptoms and to not expose people
And talk
unnecessarily.
about it.
Right. Well, let's talk a little bit more about those at-risk populations, because we did stories about the VA around the country changing some of their rules, about
Nursing
LECOM,
homes.
about LECOM and their living facilities, their senior living facilities, changing their visitation rules. What is it that healthy adults need to look for, and who is the most vulnerable population?
I think the healthy adults certainly, again, should be aware of the risks and the associated transmission. The population that's most at risk, however, are older adults and people who have serious chronic medical conditions, heart disease, diabetes, lung disease, immunosuppression for some reason. Those might be the folks that are most risk, and so trying to prevent exposure from not only COVID but influenza to that population is important.
All right, we want to take a break from the conversation right now. We want to let everyone know that our three panelists will be here for the entire half hour. When we come back, Tom has his forecast, though.